Hey guys, this is Dr. Lang with Lang Chiropractic Center. So I was at home at lunch break, and some questions that come up just about every day in the office are, should I use ice or heat? Which one should I use? Or we'll get the scenario where someone was out doing yard work all weekend, raking out the flower beds because it's nice outside, and they just kind of overdid it. Repetitive use injuries in the lower back, and then they strained their back that afternoon and they laid on a heat and pack that evening the next day, and then they get to us on Monday morning and their back is just a wreck. So they say, yeah, I pulled my back, I laid on a heat and pad all day, and now today I just can't move. So which one should you use, ice or heat? The answer is you can use both. Now there is a time and a place for either one of them. So let's take injuries, for example, acute injuries where you sprain an ankle or you pull a muscle in your lower back, or you have a sports injury or something like that where there's swelling, acute inflammation, or even a herniated disc in the neck or lower back. It's always safer to go with ice first because it can get swelling and inflammation down and make it easier to deliver a treatment. Now there's times where heat is better. So in the cases where heat is used, typically those are the patients that come in are just chronically tight, have a lot of stiff muscles in the neck and the upper traps. Patients who just feel stiff and locked up all the time. They sit at a computer quite a bit, so heat is a relaxing element that can ease the tension on the muscles and provide quite a bit of relief. Now, I'm sure everyone has their own opinion on which ice or heat feels better for them, and that's totally fine. This is just some scenarios we see daily and some patterns that we see probably most effective for treatment. So there are some situations where there has been an injury or we've performed a treatment and where we will use heat instead of ice. In the case of pulled hamstring, say you have a track runner or cross-country runner or soccer players pulled a hamstring, and we've done a dry needle treatment. We will typically use on and off heat on the muscle after we do the procedure of dry needling in the area, just to get blood flow back to the tissues and to heal the muscle a lot faster. And they do great with heat. And then down the road, you can always use ice to relieve any excess swelling that shouldn't be around after the muscle heals up. Now, there are some cases and conditions where ice doesn't feel really good, even on some of the acute injuries. And those are some ideal conditions, or I'd say rare conditions, but things like people with fibromyalgia. That's a really difficult condition. It's often misdiagnosed. But when you have a case of true fibromyalgia, those patients typically do very bad for the most part with ice. So heat always feels a lot better with them. It keeps their flare-ups way down as well. Polymyalgia rheumatica is another autoimmune type condition that tends to do really well with heat and bad with ice. So you can use either one. There's a saying we use, when in doubt, ice it out. So if you've injured yourself, there's been an accident and there is swelling, inflammation, a lot of tenderness, it's always safer to go with ice first. If you just have a chronically tight neck or lower back, joints that are just stiff, not moving well, heat is a great alternative to that to provide some extra relief after you use some ice to get maybe some swelling out before or after a treatment. So anyways, and if you still don't know which one to use, you can always just call us and ask us and give us your scenario. Maybe we can help you out until you can get into the office and we can further look at it. So I hope this has answered some questions, maybe cleared up the ice versus heat dilemma. So answer is both of them. Just got to know which one to use. So acute injuries, go with ice. Chronic injuries or long-term treatment type scenarios, you can go with heat. So hope this helps. You guys have a great day. Thanks.